So welcome everyone. My name is Shireen Ash. I'm a librarian at the Corte Madera Library, and I'm very pleased to have you all here today. We'll be starting in just a second. I'd like to introduce you to Ariana Myers, who is a volunteer educator, community educator for the Alzheimer's Association, and is going to be giving us an important lecture on effective communication strategies. Just so that you know, we will be recording this, so it'll be viewable at a later date for you to review or share with friends and family. It'll be on our YouTube website. So that's the Marin County Free Library YouTube website. Um, if you have any questions, Ariana, we were going to hold them to the end and they'll be placed in the chat. I'll read them out and then Ariana can address them. So if you have any questions, just pop them in the chat. Know that I will get to them at the end and Ariana will address them. So with that, I will disappear and Ariana, you can take it away. Thank you so much.
Thank you, Shireen, and good morning, everyone. Welcome to the Effective Communication Strategies program sponsored by the Alzheimer's Association. Today, we're going to talk about how communication takes place when someone has Alzheimer's disease. And by the end of the program, you should be able to explain the changes that take place over the course of the disease progression. And that includes decoding both verbal and behavioral messages that are delivered by someone with dementia, and how can you best respond to those in ways that are helpful. And as part of that, then we want to help you identify some strategies to connect and communicate with the person with the disease at each stage of the disease. So when we talk about communication, it's important to understand that it's more than just talking and listening. It's really about sending and receiving messages. And you can do that through your attitude, through tone of voice, through facial expressions and body language. So communication at its heart is a way to express who we are and how we relate to each other. Now, as the brain changes with Alzheimer's disease, people lose the ability to speak and to decode language in the usual ways. So the better we understand the changes that are taking place, the better we can connect with the people who have the disease throughout the course of the disease. So when we talk about Alzheimer's disease, we really tend to divide it into these three stages: the early or mild stage, the middle or moderate stage, which is a little bit of a misnomer because there are some significant changes that take place during that moderate stage, and then the late and severe stage. What's important to understand that as Alzheimer's disease and other progressive dementias progress, people lose their ability to communicate their thoughts and feelings through words. They also lose the ability to understand the words that people are speaking to them. However, they do maintain a sense of self throughout all stages of the disease. So the elements, the characteristics that make that person unique will remain part of him or her throughout the disease. So connecting with that person's self is really the key to effective communication, and staying connected and giving that person a voice even as the disease progresses. So in the early stages, there may be only just a few noticeable changes in the person's ability to communicate with words. You may not notice anything at all. And this is a good time to take advantage of the fact that the person is still able to express themselves with words, and to ask them how they would like to be helped at later stages of the disease. So the language abilities do diminish as the disease progresses, and communication moves from easy conversation more to relying on behaviors to connect, or in the late stages of the disease, you're relying even more on emotions and the senses to connect. So as care partners, caregivers, you're the one who's going to be adjusting the way that you communicate and maintain connections with your loved one throughout the course of the disease. And just remember that the essence of the person continues to be there. So respect that person, whoever they are. Adjust your communication to what is meaningful to that person today at that moment, no matter what the stage of the disease. So we're going to start with this early or mild stage of the disease and talk about communication in this stage. As mentioned, you may or may not see changes in the way the person communicates. For some people, there may be a shift with the ease in which they use words or conduct conversations. And some of the most common changes are the ones you see listed here. So difficulty finding the right words, taking longer to speak or respond because they are looking to find those words. As a result, some people may withdraw from conversations because they're having difficulty staying up with the speed of the conversation that's taking place. And then there may be some more high-level executive changes in executive function. So people struggling with decision making or problem solving. And also, they're also everyone's adjusting kind of to the shock of having the diagnosis. So there may be some more emotional reactions that are taking place compared to in the past, or the opposite, avoiding discussing the disease at all. So whether or not you're noticing changes in the way that the person speaks or not, communication in this stage is really crucial. This is the period in which everyone involved is adjusting to the diagnosis. They're having thoughts and feelings about the changes that are ahead of them. And denial, remember, that may be part of the disease for some, where for others, they take it on and the emotions are overwhelming. So it's different for everybody. But whatever the kind of initial response to the diagnosis is, it's really important to try to come to terms with the diagnosis and the emotions that everyone's feeling. And the best way to do this is to talk about it together. And that's going to help you both accept the diagnosis, to move forward, to discover new ways to live positive, fulfilling lives together. And, communicating throughout the process is going to bring a closeness as well. That's going to help everyone adjust more easily as the disease progresses. In our first video, Martha Tierney, who's the Associate Director of Volunteer Research Programs for the Alzheimer's Association's National Office, tells us how to be helpful in the early stage.
Communicating in the early stages of dementia with the person with the disease is important. At that time, you still have language as a tool, so you can learn things about what they might prefer as the disease progresses. For example, as the disease progresses, a person might have difficulty finding words. Caregivers often struggle to know what to do in that moment. Early on in the disease, you can ask. You can say, if you ever have trouble coming up with a word, would you rather that I jump in and give you the word, or do you want me to wait and allow you some time so you can find it on your own?
So just to recap a bit, caregivers do often struggle with how to help the person with communication in the early stage of the disease. But one approach or option is to ask the person directly how best to help. And asking that person their preferences, it shows that you want to help and that you're respectful of their feelings and their desires. So we mentioned asking directly is one of the best ways to find out what that person is looking for. The example that Martha gave was, if someone's struggling to find a word, do they want you to jump in and help them, or would they prefer to try and find the word themselves? When you are communicating, it's helpful to keep your sentences direct and straightforward. That's going to help the person avoid feeling lost in a conversation. So shorter sentences will make your meaning more clear. Try to avoid long explanations. Take your cue from the other person, but take care not to talk down to him or her. So it may take the person longer than normal to find words or put thoughts together and express them. So you should plan from the very beginning to start to get in the habit of allowing extra time for these conversations, so no one feels pressured or rushed. And that, the person's needs and conversational abilities are going to change over time. So in this early stage, again, it's important to let the person have his or her thoughts and feelings, their voice heard while they can still communicate through words. So you can help do that by meeting that person where they are in the disease today, and going forward regardless of the stage. But be sure always to include that person in any conversations that they want to be included in, but particularly any conversations that are going to affect his or her future. So when you include the person, it can be empowering for them and engaging. It allows their preferences to be expressed and respected. Some things to avoid. Don't make assumptions about the person's ability to communicate just because they have an Alzheimer's diagnosis. Everybody is affected differently by the disease. Speak directly to that person if you want to know how they're doing. And explore which method of communication is most comfortable for that person. So, there's face-to-face conversations. They might still enjoy sending and receiving letters. Email can give someone enough time to compose their thoughts and not feel the pressure that they might feel in a live conversation. Or they may prefer in-person phone calls just to hear the voice. It's really down to the individual. And sounds strange, but it is okay to laugh. Sometimes humor can lighten the mood, can make communication easier. But whatever you do, be honest with each other, be frank, and don't pull away. Your friendship, your support are really important to the person with dementia. And again, this is the time when you are really able to talk to them and hear their thoughts and let them express their thoughts, their wishes for what's coming in the future. So that's our section on the early stage of the disease, and the real important takeaway is to stay in communication, talk about your thoughts and feelings. Now we're going to move on to the middle or moderate stage of the disease. And this is when you're going to find a lot of significant changes in the person's ability to communicate with words. So you may have noticed some changes in the early stage of the disease. They're going to become more pronounced in the middle stage. And some of these changes then are similar to what you've noticed before, but with an increased difficulty of finding the right words. That can result in using those familiar words that are easier to find repeatedly over and over again. Inventing new words to describe something when you can't find the normal word. So you can't remember the word watch, but you can say hand clock or wrist clock. And you'll find a lot of that kind of invention is one way of dealing with not being able to find the vocabulary the way someone used to. If someone may lose their train of thought more easily, and for all these reasons, they may start speaking less frequently just because it's harder to do. And one of the very significant changes that you notice in the middle stage of the disease is a shift from communicating with words to more communicating through behavior. Some other things, someone may have trouble organizing words logically. They may resort to speaking in a native language. And something to keep in mind is that the way that the memory loss happens in Alzheimer's is you usually lose your short-term memory first. So some of these changes that you're seeing in the communication are a result of a short-term memory loss, that repetition that you hear a lot, and somebody reverting to speaking in a native language. The newer language is less familiar to them. It is lost in the course of the memory loss progression of the disease, but the native language from long time ago stays with them. So that's why you might hear people reverting to a native language. They may start cursing. That has to do more with the loss of executive control and inhibition, loss of inhibition. They may start relying on gestures more than speaking. That leads to some of these behavioral ways of expressing themselves rather than through words. And then if it's in a complex conversation or TV program, they may start to have trouble following along, as well as having trouble decoding and understanding what other people are trying to say. So again, all of these changes make communicating with words more difficult. And for that reason, people may start to rely on behavior to communicate more. So we will discuss the adjustments you can make that are going to help you continue to stay in communication with that person throughout this significant middle stage of the disease. And then one last point before we move on, be aware that some physical conditions and medications can affect a person's ability to communicate. The disease progression in general tends to be slow and steady. And so if you notice a very sudden change, like overnight, the person seems much more confused, then this may be more of a delirium that's brought on by a physical condition. Something that happens particularly often are UTIs, urinary tract infections, which people with Alzheimer's are actually prone to. So the effect of a UTI can look very much like a sudden change in cognition. And so if it is something like that happens sort of seemingly overnight, then it makes a lot of sense to take that person to the doctor. It's not necessarily a UTI, but it could be a reaction to medications. There could be other physical conditions that cause it. But the main thing to keep in mind is a sudden change. Probably you should go see the doctor, and if then it might be something that can be treatable, and in which case the person should revert to kind of how they were behaving before the infection. Okay, in our next video, Beverly shares some advice she gives to caregivers as a support group facilitator.
I would advise couples, and I usually do advise the caregiver who comes to the group and is caring for a spouse, that you take your time. Always count to 3 before you respond, because it gives you time to think about your answer and what's going on. Generally, in a marital dispute, it's quick. It's back and forth. You're quick to give an answer. When they've been diagnosed, to sit back and say, okay, you're supposed to be the one that's reasonable here. Let's change how we do this, because there's only one thing you can control, and that's you. You cannot control them and their process.
So you may remember earlier I advised that it's a good idea to get in the habit of expecting conversations to take longer when somebody has Alzheimer's or another form of dementia. Another good habit to get into, which Beverly alluded to here, is try to make sure that you remain calm before approaching a situation. So get in the habit of maybe counting to 3 before trying to address a communication issue or a behavioral issue. You can't expect the person with the disease to respond to your needs. You're going to have to really try and pay attention and understand where they are, so you adjust your communication to what's going on with them. And if something isn't getting you the response that you want, then you might need to try different approaches. So when someone is in the middle stage of the disease, there are certain ways of connecting with them that are more effective than others. It's always important to approach the person gently. Something to be aware of is that as the disease progresses, people with Alzheimer's are going to lose their ability to perceive peripheral vision, or to understand what's happening in their peripheral vision. And so if you should come from the front so that they have a better chance of seeing you and understanding that you're coming to talk to them. If you come from the side, you run the risk of startling them, and you may get a response that you were not wanting from that situation. And then as you're approaching, maintain eye contact. If you can, try to get at the same level as that person. So if they're sitting down and you're standing up, it can feel very intimidating to have somebody who's much taller than you are looking down at you. And again, what you want is to have a calm reaction. You want to try and potentially de-escalate a situation if somebody's feeling upset. So you're better off, if you can, try to be eye level and approach the person at their level. Call them by name and let them know what you're doing. So say, hi, Sarah, this is your daughter, Ariana. I'm coming to talk to you about what's you're feeling right now, whatever the situation happens to be. And then that's going to help orient them to what's happening and set the scene for a connection and a communication to take place. And sometimes using touch can show that you care. So gentle touch to the hand can help also establish that feeling of contact, of connection. Try to avoid criticizing or correcting. So again, if the person has an idea that something is going on which you know is factually incorrect, you're not going to get very far by trying to correct their perception of the situation. You're going to be better off by showing that you understand what they're feeling and taking it from there, meeting them where they are in the process. And again, trying to make sure that you're calm before you approach the person. The person, is going to be able to feel your emotion, and very often they'll reflect that back to you. So you're going to have a better chance of a good outcome if you can remain calm and composed. Again, this idea of potentially counting to 3 before approaching. And then take the time to communicate. Give yourself and that person enough time to respond and interact and connect with each other. Okay, in this video, Rebecca talks about adjusting her own thoughts and responses when her mother repeated herself.
She could sense my frustration because occasionally I would lose my patience and I would bark at her. Why are you asking me that question again? I just answered that question 2 minutes ago. And then she would get frustrated because, she was very old school and she's like, don't disrespect me. And I didn't ask you that question 2 minutes ago. It's a new question. So phase 2 of our relationship was like, okay, that's a new question. I'll answer it again.
So it can be very frustrating when someone with dementia repeats, questions or statements or behaviors. But remember, the first memory to go is that short-term memory. So they literally don't remember whatever it is that they're repeating. The other thing to be aware of is repetition is the most common behavior that you see in dementia. So it's something you should be expecting and be aware of. Again, it can be helpful to try and have that habit, whatever it takes to center yourself before approaching a situation, especially if you're starting to feel frustrated. It's easier said than done. And then trying to convince somebody that what you think is true is not likely to work. So you're really better off to try and meet them where they are and address the issue, try and understand it from their perspective. So when you're joining that person's reality, you're trying to take a little bit of time to see the world as he or she might be seeing it at that moment. So when you do try to see something from his or her perspective, their behavior might actually become a little bit more understandable to you. Due to the changes that are taking place in the brain that accompany the disease, the person will probably not be able to see your perspective. So you have to be the one who changes, who uses needs and empathy to respect and empathy to see the world through their eyes. So joining that person's reality is really the key to helping that person have his or her say, and it provides soothing reassurance to them. So we kind of list out the steps that we would take to join that person. Listen and try to figure out what it is that they want. That means paying attention to both their words and the behavior of the person. And they may be saying something about their feelings or needs, but they might be feeling something else on a deeper level as well. So the words like, I can still drive just fine, may also contain the feeling, I don't want to give up my independence, please don't take it away from me. If someone says, stop taking over my life, I hate it, that may actually reflect something deeper, which is, I hate this disease and I don't understand why I can't do what I always could. Let the person know that you understand what they may be feeling and why. whether they express that through words or behavior or both. Answer any questions, address any issues if you can, try to be brief and to the point, and then respond to the emotions that are behind the statement that they're making. So if a person is communicating with words, you might still be able to ask them, you seem sad. Do you feel sad? And if the person says yes, then you may want to guess why. Say, do you miss the way things used to be? If they say yes, then you could say, I do too. And then you've made that connection. If they're identifying more through behavior, see if you can try and identify and speak to the emotion that's behind the behavior. We actually have a whole Alzheimer's Association presentation that's dedicated to understanding and responding to dementia-related behaviors that are specific to this middle stage of the disease. So if this is something that you're encountering and you want to learn more, I would suggest trying to attend one of those presentations and get some more insight into the different, more common behaviors and ways that you can address them. And then once you've tried to respond to the emotion, you can always reassure and redirect that person's energy by encouraging them to do something else that is going to shift their thinking and behavior. So with the example above, you've made that connection of, we both feel sad. You could say, I'm glad to be here with you today. Let's go for a walk outside. Or, and that way you're kind of shifting them away from whatever was causing the behavior and directing that energy in a more positive direction, doing something that can possibly lift their spirits. Other thoughts. So keep it slow, keep it basic, take your time and be patient when you communicate. The more you slow down, the less resistance you're going to encounter because the person isn't going to feel rushed and unable to keep pace. Rushing makes people feel frustrated, inadequate. They get upset with themselves and with you. They become resistant. So taking your time, you're going to have the best chance of reducing and avoiding frustration for everyone. Other tips, give multiple cues if you can. You can provide visual cues, you can use gestures, you can point to direct someone's attention to what you're talking about. Just remember to be kind of gentle, avoid sudden movements, avoid movements that they're not going to be able to perceive because it's in the peripheral vision area. So try and make sure it's something that's in that person's direct line of sight that they can see and understand. And then any kind of mnemonic devices are fair play. So write things down, you can use notes, you can use calendars, you can label things, you can write lists, you can take photos and put the names of the people that are in the photo on the back so that the person can just flip the photo over and remind themselves of the names of the people that they know well but may have trouble recalling. Also, it's easier to answer a question if you can kind of embed the answer into the question itself. So it's much easier to say it's much easier to answer a question if it's not what we call open-ended. So like if you say, what would you like for lunch, Bill? That can leave the person a little bit overwhelmed, not able to answer the question directly. It can be a lot easier if you can say something more like, Bill, I'm making sandwiches for lunch. Would you like ham or would you like turkey? And the person can choose one or the other, or if they're still not able to choose, then you can say, how about ham? So the more that you can kind of embed the answer to the question in the question itself, that's going to be easier for that person to answer. And then get ready to repeat it as much as you need to. Remember, I said that repetition is one of the most common behaviors in the disease. Losing short-term memory means that the person may not retain whatever took place in the conversation from one moment to the next. It helps to turn negatives into positives. So especially if you're trying to get someone to do something they don't want to do, like take a shower, Rather than saying, look, it's time for your shower, you smell bad, you need to take a shower, you can say, connect it to something positive. So like, let's get you cleaned up for the day so you'll be ready for Cindy's visit this afternoon, that kind of thing. And avoid quizzing. That's really back to this issue around the memory loss, and kind of, if you're telling the person they need to try harder, or thinking that they'll know the answer to the question if they just think about it a little bit more, that is likely going to lead to frustration. So they're not answering the question because they're trying to be unhelpful. It's because their brain is changing and they literally cannot answer the question. We want to connect and respond empathetically and reassure the person, let them know that you're there and you're listening and that you hear their thoughts and concerns. The facts of the situation are not important, much less important than that person's feelings and their view of reality. Their view, their perspective, what they believe is going on, that's very real to them. It may not match your reality, but if you respond to their feelings first and let them know that you understand what they're feeling, that's going to help reduce the amount of resistance that you're going to encounter. So provide reassurance that you're together and safe, that you're there to help, that you hear what they're saying, that you understand what they're thinking or feeling, and as long as there's not a safety issue, you can agree to go with the flow on whatever it is they're proposing and find common ground wherever possible. So that can mean, agreeing to go for a walk outside. It can mean agreeing that there are monkeys hanging outside in the tree, whatever it takes to feel a connection with that person, even if it's not the facts of the situation. And make any adjustments to the situation that are necessary. So if something's happening that's dangerous, then you want to make that change, right? Turn the stove off, or whatever the situation is, and address their feelings, address their emotions, and then redirect their attention to something that's more positive. So that is our kind of extended discussion around the middle stage of the disease. And a lot of the behavioral changes that you see tend to emerge in this stage of the disease. Like I mentioned before, we do have a presentation that's all about understanding and responding to dementia-related behavior. If you want more information on how best to communicate during the middle stage. I'm going to move on now to the late or severe stage of the disease. And this is a significantly different stage than the middle stage. In the late stage, the person may only use a few words or no words at all, but they still have the need to connect and communicate. By the late stage, the person will have lost many different functions. You may feel a strong urge to do something, but keep your presence and your connection are much more important than actually doing something specific for the person at this stage in the game. But keep in mind that this person is still an adult with a sense of self, and that's going to stay all the way through the late stages of the disease. So one way to connect with that person's of self is to, for example, remember their history, respect their preferences, and really you're just trying to help them feel happy and content as much as possible. Keep talking. So the sound of your voice is going to be part of maintaining that connection. And you use familiar words and names and phrases, poems, passages, songs. Whether or not you get a direct response from the person at this stage, the sound of your voice does help maintain that connection between you. And not just your voice. You can use the other 5 senses to connect with the person. And we'll go into some examples in the next upcoming slides. In this video, Sandra will talk about connecting with her mother in the late stage of the disease.
I know that my mom feels aggravated. I know that she feels alone. I know that she feels confused. And I know on any given day, I don't know if I've made it better for her. I try, In these later stages, I've come to recognize that being really aware of the five senses is really important. Touch seems to give her a great deal of comfort. I know when I come over, I'm going to brush her hair all the time. And my husband noted to me recently, he said, you know, you should see the look on your mom's face when you're brushing her hair. She's just happy. She's just happy. She doesn't say a lot. And I do it for a long period of time. I comb it, I braid it, I do funny things with it, but it just allows me to just be with her in a way that makes her feel comfortable.
So it can help to try and just maintain an emotional connection in the late stages of the disease. And the five senses are one way of doing that. So connecting through touch, Sandra gave the beautiful example of brushing her mother's hair. Hand massages with lotion are nice. Just keep in mind that when you are touching someone, you want to make sure it's a gentle touch. And the person with the disease is prone more to injury due to the tissue breaking down, and just generally they're more prone to bruising, for example, or compression fractions, and they're not going to be able to express if something is hurting. So you want to make sure that you're being extra gentle in the touch that you're doing. And then also be aware, if you are going to use a hand lotion or something like that, just make sure it's not something that has ingredients that could cause a reaction, like some kind of skin reaction or something like that. Connecting through sight, we mentioned the loss of peripheral vision, and just in general, the sight is going to be deteriorating in the late stages of the disease. So things need to have more contrast in order for the person to visually recognize and identify what's going on. That's why we're talking about brightly colored pictures, that kind of thing. If the person is eating a meal, it helps to have a placemat and a contrasting color of plate in front of them with the food on it. Because if the colors are similar to each other, the person may not recognize what's in front of them is actually a plate with food on it. So that's just something to keep in mind in the late stages of the disease when it comes to sight. But otherwise, you know, a pleasant outdoor day is still something that someone in the late stages can enjoy as much as anybody. Sound is very powerful. If you have never watched the video called Alive Inside, I highly recommend you do. What you'll see in that video are people in very late stages of the disease. They appear unresponsive, almost catatonic, but when you play the music that they love from their youth, they come alive. You know, they move, they dance, and this just is an indication of the deep-rooted long-term memories that are connected to familiar music, and how powerful that can be to try and connect with someone who's in the late stages of the disease. And then also your voice, your gentle tone of voice is also going to be familiar and reassuring to the person in the late stages of the disease. Similarly to sound, a smell, we probably all experienced it, can trigger very powerful memories and emotions. Do keep in mind that in the late stages of the disease, the sense of smell tends to diminish, kind of like our sight also diminishes. So if you want someone to smell something, the smells need to be a bit stronger just so that they will be perceived. So you can create things that are smells that are familiar and comfortable smells for that person. Just keep in mind that some people may have allergies. You know, you want to be sensitive to what is some things with strong smells, or what some lotions, as I mentioned before. You just want to make sure that what you're dealing with is still hypoallergenic and not going to trigger an adverse reaction on the skin. So well into the late stages of the disease, people with dementia enjoy tasting foods. Taste and smell are very connected. So the wonderful smell of a cake cooking in the oven can be followed up with eating a slice of the cake, and that can be a very pleasurable and enjoyable thing for someone in the late stages. I do want to let you know as well that one of the issues that comes in the late stages is some people start to have problems with swallowing. So they don't have the muscle control that they used to have in swallowing foods. So that's something to be aware of. And at some point, people may need to have modified diets that are easier to swallow. And it's something you should be aware of when you're preparing food for someone in the late stages of the disease. So that's kind of our third stage, our severe or late stage of the disease. So we went through the middle, the early, the middle, and the late stages, and the way that communication changes through each of these stages. To summarize, maximizing our communication or connectedness with a person with dementia involves adhering to a few principles. It's important to understand what is and isn't possible to change. So that means you should really try and understand all you can about the disease and the different stages. You can do that by staying up to date with the latest information and scientific breakthroughs. All of this information is on the Alzheimer's website, alz.org. And if you know and accept the cognitive and functional limitations of the person, then that's going to help you set more realistic expectations of them as you're joining them on their journey through this disease. But keep in mind always that this person is an adult with a sense of self, and that should always be respected. Use your feelings to connect, and you convey your mood through your actions and through your tone of voice, and the person is going to pick up on that and reflect that back to you. So try to stay focused on positive feelings for that person. That's going to help you have a better chance of understanding their reality. And demonstrate your caring, listen, observe, try to decode what they're communicating, and let them know that you're there and that you're doing your best to understand what it is that they want. Communication, evolves through the stages of Alzheimer's. Adapting to those changes requires commitment. It's not easy, but by adjusting your own communication as the disease progresses, you can learn to connect deeply and meaningfully and enhance your relationship with each other. We have one last video. This is Dr. Sam Fazia, who's the Director of Special Projects for the Alzheimer's Association's National Office. And he describes the multiple effects of not caring for yourself as a caregiver.
Taking care of yourself while you care for somebody with the disease not only impacts your own health, but it really can impact the person with the disease. So for example, if you're not getting enough sleep, you might be easily irritated, which will then sort of spill over to your interactions with the person with the disease and maybe being short with them, which then might cause them to get frustrated. So it's not only important to take care of yourself for your own health, but really for you to really be a good caregiver.
So caring for yourself while you care for someone else can have an effect on both you and the person with the disease. You're going to provide better care for the person with dementia if you're well rested and taking care of your physical and emotional needs. And that's going to mean relying on resources outside of yourself to help support you through this journey. Whether you're looking for information or support, if you have questions about memory loss, you can find a lot of answers on the Alzheimer's Association website, alz.org. There is a lot of information on there, a lot of different resource tools. And so what I often recommend is if you have something specific you want to understand about, or if you're just feeling overwhelmed and wondering where to start, is to call that 24/7 helpline number that's in the lower left-hand corner, 800-272-3900. And that number is staffed by experienced clinicians 24/7. So you're always going to get someone who is well-versed and trained in Alzheimer's care answering the phone. And they'll either be able to answer your question directly, or they'll be able to point you in the right direction to get the information or the support that you're looking for. So that's a great place to start if you're otherwise feeling overwhelmed. Volunteering for the Alzheimer's Association is a great experience if that's something you have interest or capacity for. There's a lot of different ways you can do it. The most common, I think, is to participate in the Walk to End Alzheimer's, which is an annual event, a fundraising event that happens every year. There's another event called the Longest Day, which happens at somewhere around summer solstice in June, and is more of a, you design your own event that you want to do, and then you get sponsorship to help raise money for it. You can volunteer as a community educator like I am. You can advocate for legislative changes that are going to help support research and care for caregivers in the community as well. And if you are interested in learning more about the science that's being researched and the trials that are being conducted, the Alzheimer's Association's Trial Match can help you or your loved one find out if there are any relevant trials that you might be qualified to participate in.